Today we will discuss the sexually transmitted infection. It's a very important topic because it has got consequences in the maternal health as well as the female health. First, we have to define the difference between sexually transmitted disease and sexually transmitted infection. The sexually transmitted infections are the infection which are transmitted by the infected agents, but they may or may not manifest in their consequences. That is, the infections are, if they are manifested in the form of sign and symptoms, then it becomes a disease. So all the diseases can begin with infection, but all the infection may not cause the disease. Sexually transmitted diseases are infections that are passed from one person to another through sexual contact. The contact is usually vaginal, oral, or the anal sex. Other modes may also play a role, including mother to child transmission and occasionally via unsterilized needles and injections. These infections have the behavioral changes of the partners, and these include the partners may have sex with others, injection drugs, just as they inject the drugs, or the male partner has sex with other men. It is also linked to the different dating apps, camp sex, and reduced condom use. This picture shows the different modes of transmission of the infection, which I already discussed, like transmission to the mother, blood, anal route, oral route, skin contact, shared object, and fingering. There are many types of sexually transmitted infections, but in the common practice, we come across these the following infection, and we are dealing these patients in day-to-day practice. These are there's a list of the infection which include the human immunodeficiency virus, that is HIV, Neisseria gonorrhea, chlamydia, trachomatis, herpes simplex, trichomonas vaginalis, candidiasis, bacterial vaginosis, syphilis, HPV, chancroid, or lymph granuloma venereum. The infected, the infecting agents are the agents like bacteria, viruses, and parasites. Amongst the bacteria, chlamydia, gonorrhea, and syphilis, viruses are HPV, HIV, and herpes, hepatitis, or parasites are trichomoniasis. There are figures and facts related with these infections worldwide and report on the global sexually transmitted infection surveillance that is issued by the WHO in Geneva in 2018. It shows different figures of different infection and show the different rising pattern of these infection in worldwide. As it is seen that the human HPV infection is in riding trend. The syphilis is not as common nowadays as gonorrhea and chlamydia, and in some cases, STI can have serious reproductive health consequences beyond immediate impact of the infection itself, like infertility or mother to child transmission. The important fact which has been mentioned is that the resistance is there for the drugs which are previously commonly used for STI, like quinolone, azithromycin, or cephalosporin. So, resist, drug resistance, especially for gonorrhea, is a major threat to reducing the impact of STI worldwide. Amongst the richest countries, the USA is also the trend of STI is increasing in US, and there are many factors which are related with the increased trend in the infection in this country. This picture shows the trend of different types of infection, and unsafe sex is among the common risk factors which is affecting the rise and incidence of these diseases. In this picture, you can see that the syphilis is in the decreasing trend and has been decreased manifold. But the gonorrhea, once it raised, and then it also decreasing towards the uh, less number of the cases per 100,000 population. But the chlamydia is on the rising trend, and even day in every year the number is increasing. The lower picture shows the trend of increased incidence of the gonorrhea and chlamydia, especially in the American Indian population. In UK, that is in England, it has also been observed in 2010 that there was trend in increase in the 5% from in 1 year. That is from 2017 to 2018. There was increase in the gonorrhea and the chlamydia. But the increase of syphilis was less as compared to other infections. In Pakistan, the reports are very less. Data is very less, as we don't report most of the time. We don't have the national data amongst the STI. But this picture shows also that there is a increase in the frequency of the HIV infection in Pakistan, as well as there is also the gonorrhea and chlamydia increasing. Impact of the disease in different conditions. Sexually transmitted diseases are the amongst most common causes of illness in the world and have far-reaching health, social, and economic consequences for many countries. More, most STD affect both men and women, but in many cases, the health problems they cause can be more severe for women. If left untreated, the common STIs may cause complications which include pelvic inflammatory disease, ectopic pregnancy, infertility, chronic abdominal pain, and also adverse pregnancy outcome like miscarriages, intrauterine deaths, preterm delivery, neonatal and infant infections. As we know, the management is consists of triad of diagnosis, treatment, and prevention. The diagnosis usually is under the heading of history examination and investigation. Prevention is the most important part of the STI, which can cause a decreased number of the patient per year and decrease the morbidity and mortality related with these infections. We start with the diagnosis after taking history, but we must know that this should be very confidentiality should be kept very very strongly, because it's a very personal problem related to the sex, and informed consent is very important. Behavioral, demographic, and medical assessment should be done in these patients. The risk factors, which are very important, especially in the Western countries, should be investigated. Like these ST are very common in young age group. So the history of this infection below the age is very significant. Being unmarried is also important factor. More than one sexual partner in the last 3 months, new partner in the previous 3 months, and currently partner has a sexually transmitted infection. So, beside taking other points in the history, these are very important points which should be clearly identified, because these are the risk factors which can affect the health of the a person, but it can also affect the health of the person who are related to their, or meaning between their partners. Unique factors that make the youth at the risk for STIs are many. These include the insufficient screening. In UK, CDC recommend the universal screening for chlamydia, but many of the young women don't have access to this screening program. Then there is confidentiality concern. Many these young uh, persons do not disclose their problem. Then biology, that is a young women body are biological more susceptible to STI because their epithelium or Weijang, and it's very sensitive for the excess of infecting agents. The lack of access to healthcare, multiple sex partners. Presentation: the woman is in the following form: one or two or many symptoms may be present in the woman, like unusual discharge from vagina, soreness or warts on genital area, painful or frequent urination, itching and redness in genital area, blisters or sores around the mouth, abnormal vaginal odor, anal soreness or bleeding, abdominal pain, and fever. Presentation: the males are in the form of pain or burning, urination or more frequent passing the urine, pain during ejaculation, abnormal discharge from the penis, particularly colored or foul smelling discharge, bumps, blisters, or sores on the penis and genital organs. In the female, we are concerned with the female, so we will discuss the all the discussion in context with the female. That diagnosis is made by examination. After taking the history, we have to do the examination and inspection, speculum examination, by manual examination, and rectal examination. In inspection, we have to see the condition of the vulva, vagina, any discharge, nature of the discharge, foul smelling, any lesion on the vulva and vagina, like blisters, ulcers, any growth, warts, etc. On inspection, we have to see the condition of the cervix as well as the vagina for vaginitis or any other pathology in the cervix, congestion of the cervix, discharge on the cervix, whether purulent or not, any growth on the cervix, any blisters on the cervix. Bimanual examination mole is done to assess the tenderness, which shows the pelvic inflammatory disease, the size of the uterus, uterine tenderness, adnexal masses in the tubo-ovarian abscesses, or rectal examination. If there are signs of infection around the rectal anal area, then we have to do the rectal examination to assess any pathology in the rectum or in the area near the anal canal, like pelvis and the pouch of Douglas, etc. The investigations are complicated, the simple as well as the complicated investigation. In our setup, as we belong to resource countries, poor resource country, so the highly investigation which are done in the well equipped laboratory and which are expensive cannot be done in our routine practice, because most of our population cannot afford these expensive tests. The only test which can be done in our laboratory or in our OPD is the wet prep preparation. Wet preparation means when we take the specimen swab from the vagina, spread on the slide, and then put a few drops of normal saline, and after and this under a microscope, we can diagnose the bacterial vaginosis, the clue cells are present, we can diagnose trichomoniasis, or we can diagnose candidiasis. And if we put the potassium hydroxide on this slide, the whiff test is that is the fishy smell is there if we are suspecting bacterial vaginosis. Now, the most complicated tests are the simple tests are the wet mount and the gram staining, or this for the syphilis or dark field test. But the antigen detection, antibody detection, vaginal pH culture, DNA detection, these are all complicated tests which can be done if the it is available, facilities there available, or patient can afford these tests. So this is a list of investigation which are done in specific organism, like chlamydia. Chlamydia is can be diagnosed clinically. Gram staining of the discharge, antigen detection, or nucleic acid hybridization. Gonorrhea is usually diagnosed on culture or the gram staining. The trichomoniasis is usually diagnosed in the wet preparation. The herpes simplex Herpes simplex virus can be diagnosed clinically or antigen test or PCR, syphilis by antibody, venereal disease Research laboratory tests, chancroid culture, and genital warts, usually the clinically antibody detection culture and DNA hybridization. The management part of the STI is very important, and in this, the prevention is very important because if we take the preventive measures, the infection uh, can be limited severity or can be prevented to spread in the other people. There are three basic level of prevention in public health. Primary prevention is the preventing the infection before it arises. This is a primary function of advocacy. Secondary prevention is the prevention practiced after acquisition of infection and also include onward transmission to the partner and patient. Tertiary prevention is the minimization of disability from infection in the patient and instead there to extend that early treatment and therefore avoidance of complications emphasized. In nowadays they are the management is the case management, like a single case is managed in a variety of ways to treat the disease as well as to prevent the disease. It's a spectrum of the instructions and protocol which is done in case management. The components of case management are history examination, correct diagnosis, early and effective treatment, advice on sexual partner, sexual behavior promotion and promotion of condoms, partner notification and treatment, and case reporting. In 1991, WHO introduced a syndromic approach, which is simple, client friendly, cost effective, and applicable in community at primary level. STIs managed based on the clinical presentation and treatment can be given without laboratory. So the beauty of this syndromic approach is that most of the time we don't need the specific or expensive investigation, and the treatment is just like previously we used to treat in the past, that history on examination. The main infective uh, agents are grouped according to the clinical syndrome they cause, and the patients are treated for all important causes of syndrome using combination of antimicrobials. Syndromic management, the basic concept of the syndromic management is that in resource constrained situation, a laboratory supported etiological diagnosis based on STI is costly and often beyond what is available to the providers. This is also the case for most providers of STI care in Pakistan. The syndromic approach standardized the age-old method of clinical care where clinicians makes a medical judgment about the cause of complaint based on history and physical examination. An additional advantage of syndromic approach is that in practice actually minimize the overuse of antibiotics. The key feature of syndromic management is the problem oriented to the patient's symptoms, highly sensitive and does not mixed infection, treat the patient at first visit, can be implemented at primary health level using flowcharts with logic step, provide opportunity and time for education and counseling. The study discussed six major symptom syndrome, that is the symptomatic treatment which is on history and clinical examination. We will discuss either the vaginal discharge, syndromic management of vaginal discharge, lower abdominal pain, urethral discharge, genital ulcer, scrotal swelling, and anal symptoms. There's five steps in management of all this condition, that is STI case management, that the history. So first we have to take the history and examination. Then after making history and examination, we use the flow chart for the diagnosis and management. Then education and counseling on HIV testing, safer sex, including use of condoms and their provision. Management of sexual partners and recording and reporting. Criteria for selection of STI drugs. This should be the drugs should be highly effective, low cost, acceptability in context of toxicity and tolerance, Organism resistance unlikely to develop or likely to be delayed. Should be a single dose. Oral administration not contraindicated for pregnant or lactating women. The drugs which are commonly used in the practice for the STIs are cephalosporin, macrolides, quinolones, penicillin, tetracycline, acyclovir, metronidazole, azole, antifungal agents, and topical agents. Now we will discuss one by one the case syndromic management of the case like vaginal discharge. The patient comes to us with vaginal discharge, then we have to take the history. After history, we have to manage the case according to the syndromic management. Now the patient complains of vaginal discharge, itching or burning. First, we have to do the examine history and then examination, and we have to risk assessment. So we have to find out the patient who are having risk of the problem STI like personal sexual history, high risk group membership, or the person is living in the community where there is high prevalence of that disease. Now, if there is abnormal discharge or vulvar angioedema, then and then we see whether the patient is having pain or not. For that, we have to do the examination. Examination, if the patient is having lower abdominal pain, then patient is managed according to the lower abdominal pain flow chart. But if the patient is not having lower abdominal pain and she is belonging to a high risk group, that is the where the prevalence of gonorrhea and chlamydia is there, then she becomes a high risk group, and she should be treated for gonorrhea and chlamydia. If the patient is not related to the high risk group, then she should be treated for bacterial vaginosis and trichomoniasis. But if the patient is having white curdy discharge with erythema and excoriation, then she should be treated also for candidiasis. With all this management, we should always remember the four C's. The four C's stand for the compliance, contact, condoms, and treatment of the contact. We know that the vaginal discharge is usually from the cervicitis or the vaginitis. Cervicitis is usually due to the chlamydia and gonorrhea, and the vaginitis is usually due to bacterial vaginosis, trichomoniasis, and candidiasis. So we have to find out whether the discharge is physiological discharge, and if the physiological discharge and that she is not having symptoms, she should be reassured and should not be treated like in during pregnancy or इसको stop कर दे. So if the patient comes with the cervical infection, that is an infection in examination, we see that the cervix, there are signs on the cervix, we should treat her for gonorrhea and chlamydia because cervical infection and cervical discharge is due to these two infection. But if the patient comes with the vaginal infection, then we have to treat for bacterial vaginosis, trichomoniasis, and or for candidiasis. So we have to divide these patients according to the symptomatic discharge into two groups, either cervical infection or the vaginal infection. Now, the vaginal infection is treated, vaginal discharge is due to either cervical infection or vaginal infection. So, for gonorrhea and chlamydia, for cervical infection, we will treat with the treatment for gonorrhea and chlamydia, and for the vaginal discharge, we will treat them for the bacterial vaginosis, trichomoniasis, and or vaginal candidiasis. For gonorrhea, quinolones are normally used ceftriaxone 500 milligram intramuscular as a single dose plus azithromycin 1 gram is given, or cefixime 400 milligram orally a single dose, or expectinomycin 2 gram intramuscular single dose. For chlamydia, doxycycline 100 milligram BD for 7 days, or azithromycin 1 gram daily. For bacterial vaginosis, metronidazole 2 gram orally, or clindamycin 2% vaginally, or metronidazole vaginal cream is given in the form of 75%. Trichomoniasis is treated by metronidazole single dose or a metronidazole 400 milligram orally twice a day for 7 days, or this candidiasis is treated by miconazole 200 milligram vaginally, or clotrimazole 500 milligram vaginally, or oral fluconazole 150 milligram capsule only one. Lower abdominal pain. For lower abdominal pain, if the patient comes to with lower abdominal pain, we have to take the history and do the examination. In history, we have to exclude the other problems causing lower abdominal pain, like overdue period, recent pregnancy or abortion or miscarriage, abnormal guarding, abnormal vaginal bleeding, abnormal mass, or recently introduced introduction of IUCD. If we have if the patient is having these problems, then the patient will be treated surgically, or she will be referred to proper gynecological experts. But if the patient is not having these risk factors, then we examine the patient and the patient is having tenderness with cervical excitation, then she should be managed for PID management, 4Cs, and review in 5 days. 4Cs, what are the 4Cs? Compliance, counseling, it's provision of condom, counseling for STI prevention, and contact treatment. These are the 4Cs we will see in all the patient. And if PID treatment is given, if patient improves, then the treatment is continued and patient is reassured and provide the analgesic if needed, 4Cs, and ask patient to return as needed. The treatment of PID in the OPD is ceftriaxone 500 milligram once only, or expectinomycin 2 gram intramuscular once only, plus doxycycline 100 milligram twice daily for 7 days, or tetracycline 500 milligram 4 times a day for 7 days. Both tetracycline and the doxycycline are contraindicated in pregnancy. Then if the patient, especially in the urethral discharge, especially the male's urethral discharge, if the patient comes with the urethral discharge, patient as history is taken and proper history taken, discharge is confirmed. If the discharge is confirmed, then the patient should be treated for gonorrhea and chlamydia, because the urethral discharge is mostly due to gonorrhea and chlamydia. It's combined treatment or the syndromic treatment. And if the patient is not having any discharge, then any other causes should be identified, and then patient should be referred or should be followed according to other flow charts. If the patient male comes with a scrotal swelling and complains of swelling, we have to take the history and do the examination. And if the swelling is present and pain is confirmed, and then we see whether the testes are rotated or not. But if the testes are rotated or deviated, or there is history of trauma, the patient should be referred for surgical evaluation. But if the swelling pain is not confirmed, patient should be reassured. And in all the patient, 4Cs should be observed, like 4Cs mean compliance, counseling, condoms, counseling for STI, and contact treatment. Genital ulcers is any problem which can occur in the male as well as the female. When the patient comes with the complaint of genital ulcers, we have to take the history and examination. If only vesicles are present, then the patient should be treated by herpes simplex. And if the vesicles are not present, there's ulcers or sores, then the patient also should be treated for syphilis and herpes simplex. It means that if the patient is having only vesicles, we have to treat with the antiviral infection, and we should confirm syphilis by doing tests, doing specific tests. If the ulcers are healed, then reassuring and 4Cs are observed. If ulcers are not healed, then the patient should be referred for laboratory testing and specialist treatment. The treatment for genital ulcers are the first episode acyclovir 400 milligram 3 times every for 7 days, and then if recurrent, then we have to continue the disease or repeat the disease, drug as 400 milligram 3 times a day for 5 days. For the syphilis, the specific treatment is benzodiazepine penicillin, which is given in a single dose, that is 2.5 million international unit intramuscular, or alternate doxycycline 100 milligram twice a day for 14 days. Prevention is very important because there are four major components: STI control, education of individual risk or modes of transmission and means of reducing risk of transmission, detection the infection in asymptomatic subjects and subjects who are symptomatic but unlikely to seek diagnostic and therapeutic services, effective management of infected individual, treatment and evaluation of sexual partners of infected individuals. Prevention: asking the partner if they have been infected, using condoms, avoiding sexual activity with the partner who shows STI symptoms, asking partner to be tested before having sex, being aware of symptoms and signs of these conditions. There are vaccines to prevent for HPV and hepatitis B. So, in conclusion, STI common health problem affecting female as well as males. Timely diagnosis and management can prevent major health complications in poor resource countries like Pakistan. Syndromic management is effective and cheap. In the recent past years, drug resistance to commonly used drugs have been noticed. Preventive steps like safe sex, use of condom, treatment of partner, and use of vaccine can help to control the problem.